first case of coronavirus in South Africa.
Another
has
298
been
people have died of COVID-19. South Africa taking the death toll.
70 people have been admitted to hospitals around the world
to reach 1 million COVID-19. COVID-19 is getting every day.
More than half of the
COVID-19 cases. What are we attributing these rising
The number of hospitalizations has now surpassed the numbers witnessed in the first surge earlier this year.
is dealing with the second wave of COVID-19 infections.
Since the first case of coronavirus was discovered in South Africa on the 5th of March 2020, more than 2,500,000 people have tested positive for the coronavirus, and approximately 80,000 people have lost their lives. As we face the third wave of this deadly virus, the Eastern Cape province is one of the most adversely affected. The city of Gqeberha has become a ghost town, where businesses that once thrived are now empty, waiting and wanting for change. On the front line of this battle against this fatal disease are doctors, nurses, medical staff, and essential workers who sacrifice their time, health, and lives to save others. These are some of their stories.
My name is Dr. Tobisa Foto. I work at Livingston Hospital. I am a physician, now qualified intensivist. I work in the ICU section, and I look after the most critically ill patients in the hospital.
My name is Zinziswa Limba. Professionally, I am a doctor who specializes in dermatology. But during the pandemic, we've been given a release with our statutory body to serve as frontliners.
Morning. So first thing in the morning, what we do when we get to base is we check our vehicle. We need to check our oxygen, make sure we've got enough oxygen for our patients. And then most importantly is to check our ECG machine. It's the one that have a view at the heart, also gives you a blood pressure reading, as well as a saturation.
My name is Danielle. I work at GodMed Ambulance Service. I'm a BAA. I work on an ambulance every day. We take patients to hospital. We pre-hospital care. So we do treatment before we arrive at hospital.
I'm Dr. Siseko Martin. I'm a clinical microbiologist based in Port Elizabeth for the Partcare Laboratories. I'm a consultant microbiologist, meaning that I help the doctors with their infectious patients. I'm also involved with the ward rounds, clinical ward rounds, teaching ward rounds. Those entail very sick patients in ICUs and high cares, where we rotate with the doctors and doing ward rounds there. and I'm advising them on how to treat those patients.
Mentally, with having to see a disease entity in the midst of where I work and having to see a lot of deaths, the increased rate of infection and the high rate of death, I don't have words to describe it, but I think I could use just one simple word to say I was in disbelief. And it was quite a burden mentally, and also having to have a disease entity where the rapidness of infection puts us as frontliners at high risk.
My name is Kanyiswa Makaba. I started working in this company since 2017. I worked in the control room as a control room supervisor, where we dispatch ambulances. We received a call from a community. It's very stressful to work in the control room because we receive a high call volume where we deal with different people. Like you get abantu aba like very arrogant, abantu aba very impatient, where you just need to try wena ube ku level esezansi, and at that very moment you don't even have an ambulance available. So it's very stressful where you can't ungakwazi umnika olancedo alifumayo at that very moment.
My name is Odwatuhu, the founder and the director of Odwatuhu Funeral Services. Before the introduction of COVID-19, indlela besiqhuba ngayo imingcwabo was just a normal thing. We were only running funerals mostly on Saturdays and Sundays. And you'll find out that Saturday we'll be conducting about 15 to 20 funerals. Then there was the introduction of COVID-19.
My name is Kira Marburg. I'm a trainee medical scientist here at Pathway Laboratories. I do the bulk of the COVID testing. Molecular is the field that I prefer. It's my speciality. So when all of this started, obviously it's scary. It's something that you don't think that you would ever live through. I mean, who of us thought that we would be living through a global pandemic in our lifetime? It was nerve-wracking, and I think every medical professional will tell you the same thing. It's scary when you're dealing with something that we don't really know all that much about. It's new, it's deadly, so there was a lot of anxiety to start off with, and I think everybody felt like this crazy anxiety when it came to dealing with it for the first time. I mean, I can remember when the first test was done in this lab and how everybody was like so scared to even be in the same room as this thing. And when the volumes started picking up, it doesn't really give you a chance to like conceptualize the fear that you're feeling or the anxiety that you're feeling, and it becomes just another sample, and you just got to get it out as quickly as you can.
After kufike i-COVID-19 akho misebenzi, urhulumente uthakana mali, asikwazi uqasheka iikhampani ezininzi ziyaba-retrench abantu, so ithemba ukuthi laphela as abantu abasafuna umsebenzi. So kunzima nangoku as ndi-off emsebenzini, but I have to go around selling i-mask just because I don't have.
With regards to the COVID restrictions, it has just made us have to stretch the resources. So what hurts the most is when you have to provide very little support to somebody that you think you could have provided more support because the resources have been limited. Also then, people end up dying because we cannot provide the support. But also with COVID, the degree of the lung pathology that people present with with COVID. It seems to be much worse than the usual bacterial pneumonia that people will present with, because often with those patients we actually could pull them through before COVID, but the type of diseases in the lungs that comes with COVID, it tends to be much worse than what we normally will have to deal with, and therefore we end up losing more people with COVID than we would have if they had just come in with the usual bacterial pneumonia.
With COVID, we had to stop the ward rounds. We had to do some of the virtual ward rounds. So that really changed everything. Patient contact, and even in the hospitals, because they were anticipating a lot of influx of these patients, they had to change or close some of the wards. They had to stop all the elective surgeries, and allocate those wards for COVID patients. So the whole dynamics of clinical medicine really changed. We no longer have patient contacts, so we consult more sitting in the office and analyzing the specimen. And we also do the COVID testing in our lab. So it's a huge change from ward rounds, bedside ward rounds, to sitting in the office and advising the doctors instead of looking at the patients and holistically.
We were called, everybody, as funeral parlors, to say, look guys, kukho le nto ngoku iyi-COVID-19, and indlela enizawuqhuba ngayo imingcwabo ayizofana nala ndlela nidla ngoqhuba ngayo ekuqaleni. And in the meantime, we were getting bodies. We were excited to get too much bodies because we see this as a business. And we didn't know that this is going to be our danger. Especially, they are phoning us to say, we don't have adequate space to keep these bodies. Can you please keep these bodies? And you'll receive about 10, 15 bodies just to keep those bodies. It's not my bodies. Tomorrow those bodies will go to various funeral undertakers. But now, besiboni influx eninzi yemizimba. And when I phone other funeral guys to say, look, I don't have space, guys. Do you have enough space that you can borrow me? I'll tell you this. We ended up imizimba singayifaki ku tray. We'll just lay a mat or a sail or whatever plastic, and then we place all these bodies up phansi because of ixesha ebezifika ngalo and nendlela ebezifika ngalo. Government was giving us laws. Families are not supposed to view that body. Even if a family ifuna ukubona into yoba, is this the right person esimngcwabileyo? The only thing that we'll do is to take a pic. Then we send member of the family via WhatsApp, and then bawubone, and they will say, send back to us and say, hayi nguye, you can proceed. That was the new normal. It was a bad thing.
COVID has impacted me very badly because it has destroyed lots of families. There are kids out there that doesn't have parents at this very moment. It's
a mental, physical exhaustion. It has really made us all the morale down because it's the same thing. Every time our control room dispatches us on that radio, it's COVID positive patient, shortness of breath, patient unable to breathe, unresponsive patient, COVID positive. It becomes draining because it's repetitive and we can only do so many things for that patient. It's oxygen, put up a line, make them comfortable. It's very frustrating and it's mentally a burnout, and it affects your home life, because you are exhausted when you get home.
As a pandemic, it really caught us off guard. We didn't have some of the platforms that we use for COVID testing, and also the fact that some of the patients were coming in the hospital without COVID. Now they had to be pulled in or cohorted with patients or with COVID. So it was all the frustration. Where are you going to put the patients? Are you going to put the patient based on the X-ray changes? What if it's just a normal flu? What if it's just a pneumonia? So the frustration of the doctors in the front line was filtering to me personally because of the fact that they call me and say, where are the results? We sent the swab yesterday. We still... It's not very important to them that there were no flights, the fact that. But the very consoling thing was that they know the standard of our lab. They know that, we can't just be a bad lab overnight. So that sort of decreased the anxiety a bit, but it was very frustrating.
What COVID has done, it has really unleashed or reminded us that, we have to look into the mental aspect of things. And have I spoken to people? I've seen my colleagues, break down, from all walks of life due to the COVID pandemic. And we have been fortunate in the hospital to have an in-house psychologist who is available on an appointment basis to see either an individual or in a group, just to go through the issues and iron them out. If people need to take time off, people have been given time off, and if people need to get admitted, that's also been discussed, and it's an available avenue to look into. So I think the managers and the management is aware of the situation.
It's quite sad because most of calls that we have received in this third wave, it's about a husband and a wife that are both COVID positive, where they end up both dying, leaving a 15-year-old that can't take care of themselves. So COVID has really, really ruined lots of families, and it's such an emotional thing. I just want it to end. It's very, very, very painful. It's touching, it's emotional, it's depressing, it's enough.
It was quite a burden mentally, and also having to have a disease entity where the rapidness of infection puts us as frontliners at high risk. I might serve a purpose to serve and to give health advice and management and treatment to people who seek for help from me, but when then I'd have to wear that mask, I'd have to draw strength from somewhere. So that strength, I managed to draw it particularly from my family and from my colleagues who were very supportive. And that strength, I also needed to draw it from what I knew I could do best in helping those who were infected and those affected by the pandemic.
Everybody was afraid of this COVID-19 because we saw a lot of people dying. And even nathi sibesinimizimba emininzi ye-COVID-19. But the bottom line is, we need to dress these people. We need to wash these people. And the yonke laa nto, when we do it, it's not being done by a machine. Uphathwa ngumntu, ne? And we knew into yokoba at one stage nathi sizawusuleleka yile COVID-19 because I buried my mother on the 15th of December last year of COVID-19. I buried 2 of my workers. They died of COVID-19. And a lot of staff, they were infected of COVID-19. So yonke laa nto, it came to my mind, it traumatized me, and I thought, this thing is a yandifumana COVID-19, but by luck, that and right. So yonke le nto isothusile and isanyanzeleka into yokokuba masibe extra cautious.
Also, ikhe affecta one of my family members, umamam, kakhulu, and ungumuntu diabetic, and ndandisoyika that ba ndingamluza the way eyayifike ngayo kuqala i-COVID-19, because we've lost abantu abaninzi kakhulu. So ndandisoyika uluza one of my family members, especially my mom. Support, a very strong support structure is pivotal. A support structure that will understand your situation and will support you with the moments of being in despair. A support structure that will help you get pulled out of those moments of despair. When I make reference to support structure, it could be anybody. It could be any form of environment where individuals are willing to support you emotionally, support you mentally. It becomes very difficult when you're a doctor and you have a sick baby or you have a sick child. Medicine just gets thrown out most moments. But I guess the emotional support then brings you back to the moment of having to do what needs to be done as a mother, which is taking care of the sick child, the sick husband, the sick baby.
It's very nice to work in the control room where you know that sometimes I've tried to help this person, and then that makes you feel so much better inside. You like, yeah, at least I've done my job in a right way, and you get ambulance there as soon as possible.
Some of the lessons I have learned during this pandemic is to appreciate every day. It is short. I've also learned that how much you miss human touch. You know, we are a family at God Made. We really are. So we hug each other low, and we don't get to do that anymore because you can't, because it puts you at risk and the next person. What I've learned about myself, about the pandemic, is that I'm a strong person. I grew up in a family where we had a lot of support and in terms of our emotional development. And I think having had that seed planted me, manifested, and flourished and flowered during the pandemic, because I saw myself being positioned with a lot of challenges at work, at home, but I came out of it and I was able to deliver or able to assist where I could assist efficiently and effectively.
And have I wanted to quit? No, I've never really wanted to quit. I don't see myself anywhere else. Even if I wanted to quit, you also have to consider your colleagues that you are leaving behind, because this is war. We are all fighting this as a soldier. So if one of you leaves, then you are leaving the rest of the soldiers behind. So it's teamwork.
This documentary revealed to me that my experience was not far off from the ones that have been shared. I was taken back to the moment when I was infected with the coronavirus. I was plagued by loneliness and fear, utterly hopeless as my symptoms worsened. I thought that I would die. My life was turned upside down, and I knew that things would never be the same again. Even though I was plagued by such a traumatizing experience, I am standing here today as a COVID-19 survivor. I am reminded that we are living on borrowed time and that it is imperative to be grateful for what we still have. So, life may not be how it used to be, but I choose to stand resilient through it all.